I don't know, are you? See,
Generally, people don't come to me with a rash on their bottom. Usually that's a different kind of doctor, but I can says you need a prescription. I'm a psychiatrist.
no, I understand, but
little,
it's not the issue, it's the way I relate to the issue.
Oh, right, okay.
The rash on my bottom is just a rash on my bottom,
Mm-hmm.
but the way it makes me feel,
Is there a rash on your bottom?
well, now you're getting awfully personal, aren't you?
Well, I just don't know if it's an actual rash or a figurative rash.
Do you need to know this?
I think I do.
Well, let's just say, for the point of this discussion, that I have a rash on my bottom. And it makes me feel a certain way. And how can you help me?
Well, I would say that there are some topical creams and
No, you
ointments,
don't understand.
unguents.
No, you're not a doctor,
Right.
so you shouldn't be prescribing unguents.
Ligaments, liniments,
See,
salves,
you're so not a doctor.
sprays.
Ligaments, liniments. Doctors know the difference between ligaments and liniments.
That's exactly
So
the point.
if you were to help me in whatever capacity, as small as that may be, would
Uh-huh.
be, how would you help me about my rash?
Does it seem like it's constant, or does it seem like it just comes up during certain
Certain what? Wow.
scenarios, or?
Oh man, you're getting so personal now.
Uh-huh.
Do you want to help me, or are you just trying to
Oh.
dig down into my life so I'll
Oh.
feel crappy?
Well, I think I need to dig down in your life, and perhaps that'll make you feel crappy,
And you don't care. That's fine.
but that's what we do. That's what we do. Our job is to make people feel as miserable as possible.
No, it's not. You're being ridiculous now. You want to make me happy, don't you?
Yes, yes.
See, I don't believe that. I still don't believe that. That's such a phony smile. It's yes, yes. You don't.
Oh, I do.
See, it's such a fake. You don't.
I do. I
Look
do.
at that. See, it's just so. That's such bullshit. Oh, I do. I really do. How do you want me to feel, really? You want me to just be, you want me to just dig myself into a hole?
No, let's address maybe where the rash comes from.
Oh,
Not where it is, where it comes from.
it's a nerve disorder.
Mm-hmm.
See, you said that so fast. I said, uh-huh. You didn't even listen to me before you said, uh-huh. You're looking at the clock, aren't you?
Oh, I don't have a watch. You have a watch.
And you noticed it, didn't you? I noticed you caught a glimpse of what time it was.
After you mentioned it, I did, yes.
Okay, I'm taking my watch off.
So the nerve disorder has been from
Nerves.
as long as,
The sky is blue. What do you want me to say?
well, does it come up at work? Does it come up when you are nervous about anything you're anxious about, anxieties of any kind, or?
You're really getting personal now.
I'm just trying to get to the bottom of the problem.
See, that's
What's
You-
wrong?
you're making fun of my bottom.
No.
Yeah, you are.
I'm just trying to add some.
You're no therapist.
I do.
Such bullshit. Are you joking? You're not really a therapist,
No, I
are
am.
you?
Yeah, that's what the name tag says.
There is no name. What is this? No name tag there.
Oh, shit. Where's my name tag?
Wow. So I'm not going to pay for this session unless I get something out of it. You know, somebody told me I shouldn't find a therapist on Craigslist, and I said, you're ridiculous. Everything's there.
Everything. Yeah, don't listen to them. Don't listen to them.
So you really are a therapist?
Yeah, heck yeah.
Heck yeah? You're
Yeah.
not, are you?
Yeah, I really am. The secretary up front
There was no
Is out
secretary
for
up front.
lunch. But yeah. So, do you want me to take a gander at that rash?
No, I don't want you to look at my bottom. Is that what you're saying?
Well, I don't know how else I can help you. You really don't. We're going to
Well,
need
it's
to know
not-
what kind of rash it is, don't you think?
No, but I'm saying that it's not, the rash itself is not the problem. That's a physical problem. I can go to a doctor for that. It's
Mhm.
the problem is around the insecurities that I'm feeling from having the rash.
Mm-hmm.
I'm going to go to Craigslist and find a medical doctor to solve the rash. In the
Great.
meantime, I need to feel better about myself.
Are you dating anybody?
Well, apparently, I wouldn't be embarrassed if I wasn't.
Okie dokie, yeah. So what has he or she said about it?
I'm dating a few people of various sexes. It's not a deal. It's just that it gets brought up every time I get naked. Every single time I get naked, it goes straight to the rash on my ass.
Okay.
And you think that's funny?
No, I really don't. I really don't.
So what are you laughing
It's
about?
just hard for me to visualize how serious it is unless I can actually see
You're
it.
not going to see my rash. See, this is... You're just one of them.
No.
Why does everybody want to see my ass, the rash on my ass?
Well, it might have something to do with that's one of the first things you say to people.
Well, not unless it's there.
And then how often does it come?
Pardon me?
How often does the rash appear? Whenever you have a date, apparently.
Yes,
And
it appears.
that you have a nervous disorder that causes a rash on your body
Apparently so.
every time you have a date.
Apparently so. But I could have told you that. I don't need to pay you, $89 an hour.
And you see, it's 90. It's just a flat number.
Whatever.
So we have several people that you're seeing.
6 to be exact.
But
Excuse
not
me.
all at once, or yes?
There are 2 people who come together, so to speak. The rest of them I see separately. But the thing occurs every single time.
Do you ever not have a rash?
When I'm alone, I don't have a rash.
And what percentage of your day would you say that is?
A little bit of my day. What? I go out pretty much every night. But I work during the day, and it's not there during work hours.
What do you do for a living?
I work at Baskin-Robbins.
Okie dokie.
31 flavors. What?
No dairy allergies that you're aware
I don't
of?
eat the ice cream. I'm not stupid. I don't want to get fat.
All right, noted.
I mean, noted. You didn't even write anything down.
Well, what time?
This is my watch, and you don't need to...
I think our session... So, I don't take checks.
See, you
Just
haven't
money
helped...
order.
But you haven't helped me
But I
at
think
all.
we need to set up about 5 more sessions.
Well, what did we get accomplished in this session, though? I don't even understand
During the
this.
next 5 weeks, we can delve a little deeper into it, and in the meantime, I can give you a couple of referrals from medical doctors that you could go to see about unguents and ointments, creams, and some salves that you could choose from.
Are they friends of yours?
No, they're just medical professionals next door. They're right next door.
Wow, okay.
Yeah.
Well, all right then. So next week at the same time?
Mm-hmm. Yeah, next Tuesday, 7:30.
Okay then. Well, thanks. Thanks then, I guess.
Yeah, you're welcome.
Okay.
You're welcome.
Nice meeting. I hope you don't get my rash. Usually when I touch people, they get it.
And then I don't know how to turn that one off.
You gotta push this red button.